Moving on to tissue integrity. Right here I've listed the functions of the skin, the description of intact skin, partial thickness injury, full thickness injury. Categories of impaired skin: trauma, loss of perfusion, immune reaction, infection, thermal or radiation injury. In wound healing, there's primary intention, secondary intention, and tertiary intention. In primary intention, wound margins are well approximated. They heal the most rapidly. These are going to be your lacerations and your surgical incisions. For secondary intentions, the edges don't approximate, and then tissue that regenerates must actually fill the gap, and they're slower to heal, kind of like ulcers. Tertiary intention is an open wound and it's sutured closed after a period of healing. Closure is delayed due to contamination or infection. These results are the most scarring. Phases of wound healing: there's the inflammatory phase, proliferation phase, maturation phase. Inflammatory phase lasts between 3 to 5 days. I won't go through all of this right here because all of you can read and you can see that. The proliferation phase lasts a little bit longer, between 5 and 21 days. That's when you'll see the granulation or the new tissue rebuilding. New blood vessels will form and collagen structures are reformed. These wounds contract. So be sure, if you ever splint something with a wound, to leave enough space, because when wounds heal, they contract, and that occurs during this phase. Maturation phase can actually last for months. Who is at risk? Obviously anybody at all times. They can suffer laceration or some sort of wound, but the ones at greatest risk are infants, children, elders. Infants, children, older adults, as is pretty much every population at risk for anything at all times anyways, is infants, children, older adults. Causes related to dehydration, edema, impaired mobility, immunosuppression, diabetes. Precancerous and cancerous conditions, obviously, that can be your basal cell, your squamous cell, and your melanomas. Burns, I'm sure she talked a little bit about burns. First degree, second degree, third degree. Your first degree is your superficial burn, think like your sunburn, or you spill mildly hot liquid on yourself. Second degree is partial thickness. And partial thickness burns are painful, and there's blisters. And third degree burns, it's going to be your full thickness burn, and there's not going to be really any pain because there's so much nerve damage. Periods of care: there's emergent care, acute phase, and the rehabilitation phase. The periods of care we'll talk about much more in semester 4, but just to get you familiar with the phases of, burn healing, there's in the emergent phase, which is the pre-hospital care, and for those of you that are in EMS, you want to stop the burning. So if there's an oil that's on the person that's continuing to burn, you need to scrub it off. Remove any tight-fitting jewelry or clothing, maintain patent airway, fluid resuscitation, and then in the acute phase, hydrotherapy, prevent infection. This will be hospital medicine. After the patient comes to the hospital, you want to prevent infection. And so these patients will end up on a burn unit. And on burn units, visitors are usually controlled. And sometimes the patient is even in isolation because you want to prevent bacteria from entering the room and the patient even getting even sicker. Possible surgeries include skin grafts. And then the rehabilitation phase is like focused treatments. So this would be, at providing adequate nutrition and pharmacology and, possibly more surgeries, depending on, if the skin grafts were successful. Maybe you'll need repeated skin grafts. The initial skin grafts are performed in the acute phase, and subsequent skin grafts are performed in the rehabilitation phase.